I wanted to jump on acknowledging the very hard work that you all and we all have been doing. I think, we're always kind of working in response to a persistent prevailing crisis. And in times like these, it just, those crises get amplified and just shines a big old light on the things that are typically going on, and we're going to, and I mean like systemic inequalities and things that are driving these issues, food insecurity and the barriers that we see, and that's what we're going to talk about. That's what I'm going to talk about today. So this presentation, just a note, is kind of text heavy, and that's intentional because I don't have enough time to tell you everything I'd like to tell you. So you can go back to the recording, or I can share this presentation with Erica, who can share this back to you, and you can go back to the text itself. If there's time during the Q&A, I'd like to talk to you about some modifications we've been making to our programs during COVID-19, but I'd like to highlight the findings of this research that I am here to talk to you all about. So first thing, we've been, as you can see from this timeline, the findings that I'm going to share with you today are the result of research we've been working on for about 5 years. So the data here is about 4 years old. So just to acknowledge that some things might have changed in individual systems of individual resources that people use. And then at the same time, these are institutions working inside of systems that have been developing over decades and even centuries, right? So when you read about the barriers that people are experiencing, know that individuals working in institutions are doing things to change these things, and the barriers themselves and the systems that create the barriers still persist. So I'm going to begin by telling you about our multimedia elicited interviews. So the overall goal of the food access research project that this is inside of is to better understand what food access actually looks like for people living in Boulder. So what we did across this period of time was we gave participants in this research project a camera phone, and we asked them to document their experiences accessing food for 2 weeks. The idea there is that people are documenting what they feel is important about our food access. So that removes some of our, ameliorates some of our assumptions and our biases as researchers around what we feel is important. So the idea is people take pictures or other artifacts of what they feel is important, and then we interview them about those artifacts that we've created. Ideally, then the conversation is about the things that are important to people, not the things that we imagine are important to us as researchers. So this is just a note, again, super text heavy, so you can come back to this later, about how we did outreach and who the participants were. Broadly, we had 26 participants in this qualitative heavy data study, and we aimed for a diverse population. So, unlike the maps that Anne just showed you, which is pulling a bunch of quantitative data together, we talked to 26 people very in depth about their experiences. These were interviews based on those artifacts that I mentioned that lasted an hour to an hour and a half. So we got really in depth into the experiences of relative to the number of people experiencing food insecurity, a few people. So from those interviews, we transcribed those interviews, and then we collected data fragments from those interviews. Then we hosted a workshop with the same participants who gathered data, people who told us about their experiences accessing food in Boulder. And we asked that same group of people to organize those data fragments into themes. So these are some pictures from those workshops. So ideally, this is to, again, similar to asking people to collect their own artifacts. This allows people to use their knowledge and their lived experience to do the high-level data analysis. So we as researchers aren't naming the themes that exist. Participants are naming those themes that exist. And this happened across 2 workshops in 2 separate languages. So from that, I just want to show this, this to you. This is a food access conceptualization that, that we developed from those themes that people identified. So these are some big picture aspects of things that affect people's food access in Boulder. Just to note, this will probably strike you as a Venn diagram, but it isn't. And what I mean by that is that there are these main aspects that interlock, intersect, and amplify one another, and it's very complex, right? But the individual aspects aren't exclusive to one another. So, for example, even though charitable and supplemental food is outside of emotional labor, those things aren't separate and disconnected from each other. Everything in this conceptualization touches everything else and affects everything else, intersects with everything else. And this is to convey that food access is very complex, that the pieces of it intersect, interlock, and amplify each other. And we're going to focus more on barriers today, right? Like the things that we see when people, when we're talking to people about accessing food, when people come to access our services, those are the things that are most obvious to us, right? There are the things that get in people's way, right? And those also are intersecting, interlocking, and amplifying one another. They don't exist on their own. And really, the things that make it difficult for people to get food are building off of, stacking on top of, and amplifying one another to create a persistently difficult experience. And we'll talk more about that as we go. So these are the barriers themselves, or the themes themselves. And you'll notice that many of them are barriers. And in the interest of time today, I am going to basically give you a short amount of time to read these screens, which are going to be the themes themselves, and then a quote that illustrates that theme. And you won't have much commentary from me. So lack of financial resources being the primary thing we found affecting people's access to food. In hunger relief, direct service hunger relief programs, quality and quantity of food is a major barrier. And something that actually deters people from seeking resources initially in the first place. This is like a reputation issue, and then also something that can prevent people from going back. By backup and redundancy, we mean if a plan or a tool or something fails, there's another plan or tool that can take the place of the thing that failed. If we were in a time where you were commuting to work and you found your car was dead when you tried to start it, you would have another way to get to work. That's a backup and system of redundancy. Using transportation to get food, either through direct services or even going to the grocery store, is a huge barrier for people, especially for people with limited mobility. The limited hours of programs makes them very difficult for people to use. Like Anne alluded to, many of the people experiencing food insecurity are experiencing that condition persistently. What we find is that once people learn about the resources, they have an easier time accessing food. It's just not to minimize the persistent difficulty of accessing food through these systems. But it's particularly hard when people are initially finding out how to use them. Yeah, Keith?
Question, yeah. So I've recently learned about the United Way's 211 program. How often does anyone actually use 211 to find resources for themselves?
That's something I'm not sure about.
Okay.
Yeah, that's not a question that we ask people, and from what I can pull from my mind, it's not something that people brought up. So my guess would be infrequently.
Do you have a sense of how do they find out about what's available?
Yeah, that's a good question. It depends on the community. So what we found is that a lot of people use internet and web search to find out about resources. And then there are a lot of sub-communities that don't really do that and rely on word of mouth. The Latinx community is one, and the homeless community is another. I think that is because, to me, it makes sense that those communities have additional concerns, maybe about like information tracking, or additional barriers about bringing documentation and like proof of income or proof of address. And so you want to know before you go in what your experience is going to be like and how your information is going to be used. Red tape and paperwork, which I kind of just alluded to. This is a thing that gets in people's way. We found that after talking to people, there are different application systems for nearly every service they use. And each one has different requirements, and they have to prove and often have to prove and reprove income, residency, and a number of things. People do a cost-benefit analysis to see if these applications are worth it. Often they are not using services because the thing that they get back from doing the paperwork and application process isn't worth it to them. Not everything is a barrier. And often people talk to us about how people are helping one another in their community access food, how their neighbors help them access food, and really just how people deploy their own systems of ingenuity and community to increase their own food access and the food access of their neighbors, friends, and family members.
Lindsay, can I interrupt you? Good morning.
Hi, Ingrid.
Hi, this is Ingrid. Hi. Hi, this is Ingrid Castro. I work with Boulder Housing Partners. I am part of the resident services team, and I just wanted to add to Keith's question about how do people get connected with resources. So while we do not serve every single community that is managed by BHP, the resident services coordinators do connect with residents and do share those resources available in the community. I will add more at the end of this presentation about what we're doing with, of COVID-19 and how we're connecting with residents. Not only that, but also voucher holders who do not live at BHP properties, but live within city limits do also get similar resources through different channels. So I will add more later on to not go on a tangent, but just wanted to add the resident services coordinators and also through the gestores culturales, which are the cultural brokers who have connections in mobile homes and also other communities are a great asset.
Thank you, Ingrid.
You're welcome.
Shame and stigma. And lack of respect. And one thing that we see is that the emotional work required to use food service, to use hunger relief services is a thing that can keep people from using them initially. And then if people have a bad experience, obviously keep them from going back to that program. And ultimately, unfortunately, even using other programs. And control. Ultimately, we found that people want more direct input, control, and say, and decision-making power in the food systems that they use. An extension of that is wanting more participation and more voice. So we're going back to this very, very complex graphic. So what I would like to do, now that you know the barriers that people identified, I would like to zoom in on these 4 major themes, which are health and well-being, community, root causes, and invisible work. And I'd like to talk a lot more about those things, but I'd like to just present some high points to consider in your work. So one thing, we've been talking about the barriers, but one important thing to consider is the root causes, which essentially is asking why. Why are people having a difficult time accessing food? It's really not enough to talk about who's disproportionately affected by food insecurity or hunger. And it's not enough to troubleshoot these barriers by themselves, although it's important, it is important that we do that. However, it's not enough. We have to ask why. We have to say why to one another, to ourselves, to our leadership in our work. And then we have to address the why. We have to do that difficult work of getting at the root causes. What is causing and perpetuating hunger and food insecurity in the first place? Barriers are just the symptoms. And how are we going to get at the root of these issues? It's a much bigger discussion. Health and well-being. So what we have found talking to people is that we are addressing the worst symptoms of food insecurity and low income and racism and classism with hunger relief work. However, people are painstakingly requiring the resources that they need for survival, and this has ultimately negative long-term impacts on their mental and physical well-beings. One important idea to explore is the idea of food apartheid, popularized by Karen Washington. And I provided a link for you there to read this article and learn more. And it might be an idea you're already exploring and familiar with. The idea here is that even with our systems that do help, do ameliorate problems, people are still long-term dying because of the impacts of racism and classism. And that includes food insecurity. And that is something that we need to address. Important is, in our research, something that came up is this idea of invisible and emotional labor. Important to know that getting food in the charitable and supplemental food system is barrier, time-consuming, emotionally demanding, and expensive. It's traumatic for people, and it's ultimately not free. So we, I think this is difficult to see providing people with resources that they need, and they are very appreciative of. It's a lot of work for people to get these resources. And this invisible labor, this emotional labor, is one of the things having a negative impact on people's emotional and physical health. And then finally, community. So one thing that we found is that people are very resilient, and they're often relying on their own ingenuity, their own communities to get food. And that people are getting food through those means as much as they're getting food through direct services. People have a desire to be independent, help one another out, and have more input in control in their own systems of food access. Sorry about this, kind of jumping around. And one of the things that it would benefit for us to do as direct service providers is to support them in having more input, more control, more decision-making in those systems of food access. Which brings us to our recommendations. So again, we need immediately to focus on eliminating as many barriers as possible. One thing that easily rises to the top is some of the requirements around red tape and paperwork. Do we need all those things, and why? Rethink and re-question what is possible. Can we just get rid of all of these things that are making it very difficult for people to access food? In your organization, conduct a root cause analysis as a first step. This is basically when we do a root cause analysis, we identify a problem, and then we just continue asking why that problem exists. And then we can begin to work on those root causes. Build relationships of mutual trust and respect. Focus on becoming a more participatory organization, and redirect your resources to community-based solutions. These transferring power and control to people takes a lot of time, and it can often feel scary. And it is a lot of work. One thing that we're doing at Boulder Food Rescue is trying to support other organizations in that. So I invite you to stay tuned. We are hosting a webinar in June and in-person workshops in November around building more participatory community-based systems. We're also building a website that presents these findings in a more interactive way. That is dropping in July, and you can reach out to me for any of those resources.